Welcome to the very first episode of Dr. Bile as we look into the parasitic infestation. The most important topic nowadays is scabies, and the first more important thing is that about the learning objectives to know what this video is comprising of. So for this, we will be looking about what scabies is, like which bug causes it and how the transmissions will occur. So these general things, and about the bug. This is particularly a low yield one, but it's good to know. And again, the important thing to know about is the clinical features, and we will know how to diagnose it clinically, how it to differentiate with other things, and its types of scabies, because scabies may differ in the immunocompromised patients. In the other ones, we will be looking into again into this topic. And the fourth thing is this diagnosis, and the sixth thing, the most important, is the management. We will be looking to another video specifically on the management, because there are certain drugs which are not to be given in the pregnant patients and the children's. And for most important thing is that how to apply a solution. All these things we will be looking a little bit on this video, but we will try to get into another video. So the first is the scabies is caused by the parasites Coptis scabii, and the variety is humanus. So it's really important to know this because it's a factual one. You can't have a concept of this. Yes, this is a simple question that can pop up or on your exams. So it's good to know that this is a parasite and it's caused by the Coptis scabii. And the first important thing is that the transmission rate is really high. It can get transmitted through the linens, through the beddings, through the clothing, through the close contacts, and 15 minutes contact with the affected individual is enough. You can imagine how high the transmission rate of scabies is. And the other thing is another factual knowledge about this. This is also known as 7-year itch. The water wash diseases, basically water wash diseases are those which are associated with the poor hygiene, like associated with the less use of the water. And another terminology you can say that is neglected tropical disease. Basically this is the words that are used by the WHO, so it's good to know this. Let's get into another one. Is about the bug. Basically it's just a factual knowledge. You have I don't consider that it can pop up in exams, but it's good to know. There's 4 pairs of legs, and the male and female both are there, of course, for the bug, but the male dies after the copulation or the mating. So the female, the only thing which I can expect you to know, or you maybe this is on some hard day, that the female bug is not the male, it's female mite that is responsible for the clinical manifestation, which we'll be looking later in the video. And this is a general life cycle as for the other bugs it stands for. So now the scabies bug is a female mite, as I know, and I told you why it's female, not the male mite. And then infects the skin, and then it gets through the, basically there's a layer, the epidermis and the dermis, and the epidermis have layers and layers. So it gets into the stratum corneum. The bug enters the stratum corneum, where basically this is the first layer, and that strain gets into the stratum malpighi. And at the end, like it's a burrow, we will be looking in the other slides, in the immediate slide, that the bug is getting into the tract, and this is the tract that the formed by the bug is called the burrow. And at the end of the tract, it lays down the eggs, so the other bugs will hatch out from this. So this will be looking at this is the picture of from the book of the dermatology, and this is what a burrow is look like. And this is, look at the tract formed by the bug. Look at the beautiful tract. So it can be a spot diagnosis. So the fourth thing is that clinical presentation is really important to know, that the incubation period is 2 to 4 weeks. Like you can have a contact with the affected individual, and you are likely to if you got the mite in your skin, then it can manifest all the clinical presentation after the incubation period of 2 to 4 weeks. It's good to know this. And now the signs and symptoms include the nocturnal itch. These are the really important slide to know for you to pick up a question in your exams, or you can make out the differential for the other diseases. Nocturnal itch is a classical presentation, and the positive family history is also known as. I'm not just going to let you stick to just a positive family history, but you can have a like in school, with the close friends, all these like a positive thing all the happens, because family history, you have a like close contacts, you can catch it easily. And burrows can also be seen, which I have shown you in the previous slides, and this is really important one. But I will not stick to this again, because once the patient is in I'm specifically talking about the adults. When they scratch it, you just can't see the bruise clinically. It's quite like it's not quite prevalent one, but it's really important to know by the specs of the exams. They may get secondarily infected, of course, when the skin has been shown as a skin is affected by the other organisms, including the staph, the naughty one always there, and nocturnal itch, positive family history is really important to know. And one of the important thing is that the nocturnal itch is importantly in a different sites. These sites are really important to know. It's interweb space, axilla, groin, genitals, and nipples. These are the sites, and you might be wondering about what I am doing with this picture here. This is just a site showing the axilla, the wrist, the interphalangeal spaces, the genitals, all these things. Basically, this forms an imaginary circle which we called as the circle of Hebra. So this is just good to know this. I'm repeating once again that the nocturnal itch, which is specifically for the scabies, is now presenting with the commonest sites as the axilla and the waist and genitals. This forms an imaginary circle which I am calling, or the book calling, is circle of Hebra. This is really important to know, but I'm again clearing that these are the sites, but not specifically, because in the other slide which will be talking about the types of the scabies, there is a scabies variety about the infants and the child, where the most common thing is about the palms and the soles. So it's not about the golden rule, but yeah, it's good to know about the circle of Hebra. It can be asked about you, it can be asked in your exams. And now the fourth important thing is about the types of scabies. This is really important to know, because in the end we have the clinical keys in which I've tested about this question is the crusted scabies. They also known as the Norwegian scabies because it's first discovered or described in the Norway and occurs in patients. This is really important to know, because look at the journal questions, general mindset of the examiner. It can ask the question directly from you. It can present the case that the patient presents with the nocturnal itch and this and that. But what he can add is that he can present the patient with a neurological disorder, Down syndrome, immunocompromised, or the transplant patient, HIV, older patients, those immunity are down, or those who can't, like the itch. Itch is a normal protective phenomena for this. So it can present the crusted scabies, it can present with all these things, and the mechanism is that they can't scratch, bruise accumulated, and heaped up crust is formed. Look at the heaped up crust. This is what a crusted scabies is, and it's basically millions of mites. Why the millions of mites? Because if one can't sketch out, so the burrows, which are the linear linings laid down by the mite, the eggs has been laid down by the mites, and you can't sketch, so the eggs is been accumulated here. All the eggs has been accumulated, and this will get to the another millions. It's been hatched out, and again the mites has been formed. So it's basically the millions and millions of mites out there, and it's responsible for the institutional breaks and the management. Of course, I am not dealing with the management of the general scabies, but I find it like important to write down the management of the crusted scabies right here there at the end, because these species are needed to admit into the hospital and treated with both the topical and the oral antibiotic. Is the extensive management we are needed to do so. And again, the few more varieties, the infantile scabies. Look at the face and palms and soles. This is really important, because if you have a superficial concept, you can just say this is just affect the circle of Hebra, this just affect the axilla, groin, nipples, and the intervallar space, but not that this not extends to all the time, because infantile scabies is something that is affecting the face, palms, and soles as compared to the versus the adult scabies. And more importantly, the vesicles can be seen, because again the infants are not doing the scratching ones now. They're really small. They just cry. Okay, so the adult scabies, the adults basically scratch out, and the vesicles are not seen in the scabies because we scratch it out. And the other one is the nodular scabies. We will be looking into the picture again, and it is due to the delayed type hypersensitivity reaction. It's really important to know this. And the animal scabies, where the burrows are absent, which I have told you earlier in this video, that is really important to know that this is a really important to this is a buzzword for the scabies. But for the animal scabies, this doesn't stand true. And the genital scabies, basically if the patient comes with genital scabies, it should be diagnosed with this STIs. You look for the STI and to rule out it. And another thing is the scabies. Basically, this is the infantile scabies where the soul is being affected with the scabies. Look at the regions out there. And this is the nodular scabies. It affects the axilla in a child. Look at this. Look at the nodules out there. Okay, now it comes to the diagnosis. Basically, the diagnosis is mostly clinical. Clinical means on the history of a patient, that the patient presenting with a nocturnal itch, and they particularly in the interweb spaces, all these things. If unclear, then the wet mount can be taken, but it's not being generally done. It's basically treated clinically. And if you take it the wet mount and you look into the microscope, you can see the mite, eggs, and the fecal material of the bug, which is known as scabella, can be visualized. So now the management is comes with a 5% permethrin is drug of choice. You can use all these drugs listed there, and for pruritus, for the itch, you can use the methanol, all these things, but the primary mainstay of the treatment is 5% permethrin. Do watch the another video on the management of the scabies, where we will be talking about how to apply these solutions and solutions, all these things. And now comes the management part, which I have like put it in a slide, is that the counseling is the key. You have to counsel the patient. That is nothing has been going back to the happen. It's the age. All you explain the symptoms and try to counsel that not just only the patient needed to apply the solution, but his family members, his contact peoples also, because you have seen in the earlier slide it's a high transmission rate. Because if just the patient with the itch applying the solution and not the other ones, the other ones get the scabies, and the other one patient which earlier presented to us can also get again. So basically we need to counsel that all the family members need to apply the solutions, and patient should be advised that the itch can take 6 to 8 weeks. Basically it's a phenomenon, because a solution just rule out the mites and all these things, but it's itch that it may take sometimes 6 to 8 weeks. And persistent itch leading to patient, this is a really important point. If you don't counsel it, if you don't tell them the counseling is poor, if you don't tell them all these things, they can be applying all the drugs by themselves, and that can lead to the irritant dermatitis. This is really important to know. And now the clinical keys is here's a short bit for you. The 60-year-old patient diagnosed with a chronic kidney disease, undergone renal transplant. This is the key what to highlight out there. And healthy previously, now presents to the OPD with a crusted lesion, that's again a buzzword, on his body surface, which he never developed previously and attributed to occur after the transplant. So moreover, he's also suffering from some neurological disorder. His vitals are normal. What could he be suffering from? The one thing is that the renal transplant patient and the lesions that occur is attributed to occur after the transplant. It means that what happens after transplant, he most likely be taking the immunosuppressive agents as a part of the transplant therapy, and he now psoriasis is unlikely. Lichen planus is an autoimmune disorder. Photodermatitis is not just a crusted lesion, it's just its presentation is quite different. So crusted scabies or the Norwegian variety is really important to look for. So the correct answer here is C. Now come back to the second question and the last question of our discussion today. A 25-year-old patient have nocturnal itch, particularly in the genital area in interval space. As I have told you, the circle of Hebra have undergone treatment for the disease. Though the skin lesions resolve, he continues the treatment for the itch without consulting the physician. What complication he is likely to develop due to drug? I have just told you previously that if the counseling technique is poor and you don't tell the patient that the itch can take 6 to 8 weeks to resolve, he can continue the treatment and most likely to develop is irritant dermatitis. So option A is correct here. And this concludes the discussion for us. Thank you so much. We will be looking to do the more topics and we will join you later.